Hello, this is Dr. David Green, CEO of the Georgia Pain Network. Today's topic is what you need to know about acute and chronic back pain. Over 90% of Americans will experience back pain at some point during life. Regardless of whether or not treatment is sought, 90% of back pain gets better within 6 to 12 weeks. So therefore, by the numbers, an unfortunate few will end up with chronic back pain. The definition of acute back pain is 6 weeks or less, subacute is 6 to 12 weeks, and then once it gets over 3 months, it's called chronic back pain. It's the second most common reason for doctor visits, just behind the common cold. Half of all working Americans admit to having back pain each year. It's the most common cause of disability worldwide, and the direct and indirect cost overall is about $100 billion. With regard to the causes of back pain, we'll talk about both the soft tissue causes and the hard tissue causes, i.e. bone. Now, for soft tissue, back sprains and strains are far and away the most common cause, such as, you're moving, you throw your back out while lifting up a heavy box. Looking at disc degeneration, the normal disc you can see on the left, it has two layers, the annulus, which is the outer layer, and the nucleus, which is the inner layer. The nucleus has no nerve endings at all. It doesn't feel any pain. The annulus does have some nerve endings, so if you have degeneration and some tears that occur here, then it can cause back pain. So here you see a normal looking disc, and then you start to see disc degeneration and some bulging, almost like a tire losing air. It starts to bulge, okay? And that can be painful. 40% of the time, degenerative disc disease is the cause of back pain. Now, if you have a tear where a piece of the disc actually comes out, that's a disc herniation. It can pinch on a nerve root as it's trying to get out from the spine. That can lead to sciatica, okay? Here you see a tear in that outer portion of the disc. That can cause pain by irritating those nerve endings. Here you see a cartoon of sciatica. You have 3 nerve roots on the bottom of the spine that come together to form the sciatic nerve and runs down the back of the leg. If one of those nerve roots is getting pinched, it could be a bulging disc, it could be a herniated disc, and pinching a nerve root, it will cause potentially pain down the back or the side of the leg. Moving on to the bony causes of back pain, far and away number 1 is degenerative arthritis of the back of the spine. What you see here is disc degeneration, and then that shifts forces to the back of the spine and causes degeneration of the facet joints in the back, and that can cause significant back pain that's chronic. There are 2 SI joints, sacroiliac joints, on the bottom of the spine. Basically, they connect the sacrum to the ilium, which is the pelvis, and there's one here and there's one here. They can be a significant source of back pain. Anywhere for up to 25% of the time, back pain is coming from the SI joints. When you look at scoliosis in adults, what you see is that you have significant degeneration of the disc and the joints in the back of the spine, and basically it's asymmetric, so you end up with a curve. And you can have a lot of back pain, or you can also have nerve root pinching. That's called spinal stenosis, because look at this, you have plenty of room on the convex side for nerve roots to get out. But when you're pinching down on the concave side, nerve roots start to get pinched, okay? So that's not so great when you have back pain and leg pain. Now, spondylolisthesis is also due typically to degeneration, where one vertebrae starts to slip on the one below it, and that can cause significant back pain, possibly leg pain as well, because it's actually pulling forward the nerve root that's trying to get out here. Okay. Spondylolysis is common more in adolescence, where you have a repetitive activity such as gymnastics, football, and the like, that puts repetitive stress on the low back and can cause a stress fracture of this anatomic region. Okay. Spinal stenosis is due to degenerative arthritis. Basically what happens is, here's looking down on the vertebrae, and then this nerve root as it's trying to get out. You start to get overgrowth of bone and hard disc here and here, and it just pinches on nerve roots here, and it usually occurs at multiple levels. Uncommon causes of back pain would be infection, fracture, or tumor. Fracture is not as uncommon. I mean, there's close to 1 million vertebral compression fractures that occur every year in the U.S. There's probably a lot more, but a lot of them are not painful. If they are painful, typically you end up getting some back aching, some pain, maybe some pain going down into the buttock area. The top non-operative pain management in Georgia is through the Georgia Pain Network. There are several clinics throughout the state accepting over 50 insurances and providing over 25 treatment options with the board-certified doctors. Visit us online at georgiapainnetwork.com and then call us for more information and scheduling at 404-850-9099. I'm Dr. David Green with the Georgia Pain Network. Your pain stops here.